Thank you, doctor. I think I am audible.
Yes, yes.
Am I
you
audible,
can.
doctor?
Yes, yes.
Okay. Okay. Let's start our session. Good morning, good afternoon, and good evening, everyone. I welcome you all to the 2017 day of uninterrupted daily webinar of IFPH. Let's start our session with the silent prayer. Thank you all. Our today's guest is Dr. Hubert D. Silva, Chief Physician, Homeopathy Clinic, Trivandrum. He is having 35 years of experience and he is one of our moderator at IFPH. Now, he is here to present on the topic of management of neurological disorders with homeopathy. Welcome you, doctor, and the session is yours.
Thank you, Dr. Shraddha. A few minutes back, Dr. Ganesh called me. 2 days. Guest is not coming, so I prepare. Please pray for me. Today, last time we had taken ethical neurological management of. Let me share the screen. Is it visible?
Yes.
Yeah, doctor.
Matthew 6:22. The light of the body, the eyes are like a lamp for the body. If your eyes are sound, your whole body will be full of light. But if your eyes are no good, your body will be in darkness. So if the light is in you, is darkness, how terribly the dark it will be. This we read last time. And it is very much important that the eyes, this is our face having if we have a bright eye, that will give you, the others will be happy while seeing us. We have our own light. We are follows our views, visions, and the light. We got it from outside. From there is inside, there is also a light. That is why a blind man can live. Inside him, there is a sight, there is a vision. But outside, he cannot see, even though he cannot see his outside world, but inside, there is an eye. Through that eye, he could understand the things. Now, John 8:12 says that Jesus told that. Jesus, the light of the world. Jesus spoke to the Pharisees again. I am the light of the world, he said. Whoever follows me will have the light of life and will never walk in darkness. That means we have our own light, and God is also another light, the supreme light of God. That God will lead us. People may have his own light and the Paramatma light. That is how we know that the Valmiki, Vyasan, all people were written Mahabharata and Vedas, how they could possible that in that era, in that time, they could write such things. Vyasa Mahabharata is a wonderful, we know that I have read Mahabharata in my younger age, twice I read. I astonished how they have written such a beautiful scriptures in that time. They never studied anywhere, but they have a light. They were guided by some light. That is why these books always guide us. Gita, Bhagavad Gita, always lead us. How they have returned in so many years back there, these are the things returned. Whenever we read these books, we will really wonder how in Mahabharata, I have seen that Bhishmacharya talked to Dharmaputra, the economic management, how to rule the country. And in Bhagavad Gita, to Arjuna, Lord Krishna says so many things. Still, they are leading us. That is also like this in Bible. Jesus says that I am the light of the world. The God is the light of the world. I am the light of the world. He said, whoever follows me will have the light of life and will never walk in darkness. They are guided by God's light. That is how many people are. They are not studied anywhere. They are not studied in any university, but they lead us. That is why we are lived in a very beautiful land. That is India, a spiritual land. No other land has such history or heritage. Some countries, a very few countries having such a spiritual world. That is our blessing. It is a blessing from God. Let us go to our subject. Today we are talking about eye. The second part. Last time we've gone through hormones affecting. Before that, let us see. Hello?
Yes, doctor.
Then let us go to how beautifully God created these eyes. And we have to keep it always open. Then last time we discussed about this. Hormones are affecting. These are the main hormones affecting our eyesight. Mostly in women. Estrogen, we know that the estrogen changes. Primary eye functions and the symptoms balance. Estrogen, tear, stability, and blood flow. These are all changed. Severe dryness, burning, pressure. Progesterone, fluid balance, ocular pressure. Eye pressure, just we've gone through it. The thyroid, T3 and T4, muscles and nerve sheath, health, blurry vision, bulging pain. Cortisol, inflammation, control, floaters, visual snow, fatigue. Insulin, lens and retinal health, fluctuating, blurry vision. These are main things. But let us go to each and every one. Estrogen, whenever there is estrogen changes taking place, we know that the low estrogen levels are one of the most overlooked causes of chronic dry eye. Particularly in women, hormonal changes significantly impact the stability of the tear film. So they may come with us some dryness or irritation or whatever the complaints during the time of menopausal period. That is in between that whenever there is the cessation of menstruation. That time before the menstruation and after the menstruation, there will be 3 years. These symptoms may develop. There is irritation, itching, and burning. We never think that it is due to hormonal imbalance. We think that there is some infection or something like that, but that is not right. In such conditions, there may be some infections may be there, but there is chances. Some irritation, that is some sand-like sensation in the eye, that is due to the inflammation of the blood vessels of the eye. Gritty sensation, that we know. Redness. Contact lens intolerance. Whenever they put some contact lens or something for the aesthetic sense, that may also irritate. Morning dryness. During the time of morning, there will be dryness of the eyes. Why? If they are not taking proper water at night, after the digestion, there may be less water in the blood. There may be some dryness. That is why there is heart attacks are happening in the morning time. Blood thickness will be more. That time the blood flowing through the blood vessels is somewhat not in the proper way. That is why the irritation may be in the eyes, and there is chances of heart attacks. We know that heart attacks are mostly common in the morning hours. So the water balance we should regulate. Morning dryness, that is why it's happening. Estrogen supports tear film stability. Estrogen helps tear film stability, tear flows. We need tears. Otherwise, there will be irritation of the eye. The movement will be difficult, and we will not get the good condition. That is why if the tear production is lessened, that time there will be dryness and the movement of the eyes will be very much fatigue, may feel. Anti-inflammatory signaling. It will help. Estrogen will help anti-inflammatory signaling, but there is production less than the inflammatory condition will be there. Blood flow to ocular tissues. Blood flow, the flow of blood to the areas maybe should be corrected with estrogen treatment. Here we see having the redness of eyes and irritation of the eyes. So which medicine is more useful? Here we can use Silesia is a wonderful medicine to regulate or to correct the itching of eye. Then graphitis, then laxative. But these are the three important medicines we can use. Graphitis and sulfur in cerebral potencies, we can use cerebral 3, we can use. And one eye, if the one eye is infected, that time also we can use. The both eyes can also be used sulfur. In addition to that, I told the last time that very important medicines are Euphrasia, calcarea carb 30 can be used as eye lotion. It is a wonderful medicine. Sometimes it will cure the dimness of vision. So we can use, you can try. All should try, because I have so many experiences. One doctor, Dr. Shalini, told me that it is once she used, but immediately the eyes were opened and she got a sight. That operation was fixed. That time he had given calcarea carb in eye lotion. That operation, they told that there is no need for an operation. After seeing that, development within a few days. That is one of a miraculous cure. So normally I used Euphrasia with calcarea carb 30. 3 drops in 10 ml bottle and 5 drops of Euphrasia. And another medicine, they say that Cineraria martima. Cineraria martimacora. That is a general medicine. We can use these three medicines generally for eye lotion. Then progesterone. High pressure, visual fatigue, progesterone helps regulate. High pressure, we already gone through that video. There is high pressure changes. In high pressure changes and visual fatigue. If the eyes are bulged or inflamed, that time visual fatigue may feel. Difficulty while seeing the light and photophobia. Fluid balance. Progesterone corrects fluid balance. High pressure, neural calmness, low progesterone may contribute to high pressure sensations, headaches behind the eyes, visual fatigue, light sensitivity. This is common. Progesterone level. If the progesterone level is low, that time high pressure sensations, headaches behind the eyes. Why? There are only a few places is there. It is inside the cavity. If the pressure more, that time the cavity may feel. Space occupying disorders may have. That time we may feel some difficulty in, especially ladies, visual fatigue, light sensitivity. This is common during, and also in luteal phase, premenopause, high stress periods. Because during that time, we know that all people, more maybe male and female, the age between 30 and 60, their life going through very speedily. They have to face problems during that time. If the problems are because we have to look after our children, look after our parents, and that time we are leading a very hectic life and speedy, very speedy. Within no time, we will reach from 30 to 60 years. After that, there will be a lagging from 60 to, because almost our job will be over. That time we will get some calmness and coolness. So these are the reasons may aggravate these conditions. So the progesterone level and estrogen level, we should try to maintain. We have the medicines where what are the medicines we are using during the time of menstruation? We know that laxative, graphitis, sepia. And in addition, we can see that these medicines may have some complaints may be related with the eyes. Then comes thyroid disorders. Eye symptoms often missed. Thyroid hormones directly affect extraocular muscles, tear glands, orbital fat, nerve conduction. Eye symptoms linked to thyroid imbalance, bulging eyes, dryness, double vision, eye pain, blurry vision. These are the main situations we may face. Thyroid disorders. Nowadays, most of the ladies having thyroid problem, and also in men. Why? Because of the lifestyle disorder. Whenever we are away from the nature, we will affect a lot. One of the main reasons, they are taking unnecessarily iodide salt in their life. After that, these symptoms are more prominent in seen in more society. In our younger ages, a few person having the thyroid problems. Nowadays, everybody having thyroid problem. Why? Most of the doctors, after seeing these conditions, they say that using iodized salt is not good. If it is required, then we can take. If it is necessary, then we can take. Otherwise, we should use, because always we will get iodized salt only. Why? But for agricultural purposes, for to put the coconut trees, they are manufacturing salt. It is not iodized. So we can use it because it is cheap. And with 10 rupees, we will get a packet of salt, not iodized salt. So these are the other symptoms we can see in thyroid disorders. That is more thyroid hypothyroidism as well as in hypothyroidism. Eye symptoms, they are thyroid hormone directly affects extraocular muscles. That is why squint may have. In the later eye time, the following muscles are not properly functioning. So there may be chances of squint and other things. Tear glands are dryness, and tear glands are not producing much water. The tears are not producing, so there is dryness and irritation. Orbital fat. We know that fat is everywhere. That the fat, we know that due to hypothyroidism, there is adiposity. That adiposity also affects the eyeballs. Nerve conduction. How it is happening? We know that whenever there is hyperproduction of more production of hormones, this thyroid hormone, there will be chances of agitation, and nerve will be more effective, and hypersensitiveness we can see. In hypersensitivity, we can use hepasulf. Hepasulf is one of the important medicines for use hypersensitivity. And photophobia, we can use hot melatonin. Now, bulging of eyes, that is, we know that thyroid hormone, hyperproduction, bulging of eyes, the bulge of eyes towards front, and this eyelid lids are opened, and while they are sleeping, they're open with open eyes. It's also very dangerous. And in certain conditions that whenever we are using with open eyes, they are in the thyroid hyperproduction, there's opening of eyes, opened eyes. There will be opened eyes while sleeping. That time the air conducting with our eyes may irritate. The dryness, double vision. Another thing is double vision. Another symptom, double vision. Which are the medicine for double vision? Gensimia, postigum. Then eye pain and blurry vision. Blurry vision, these are we can see in thyroid disorders. Then another comes cortisol, stress, and eye inflammation. Chronic stress elevates cortisol, which disrupts tear composition, reduces blood flow to the retina, increases inflammatory cytokines. This leads to eye pain, floaters, visual no sensations, worsening dry eye. We know that what is the physical risk and pathological changes while in cortisol production. Stress hormone, it is called as a stress hormone. Whenever we have stress, our eyes will become red. Isn't it? Sometimes, without stress, our eyes may become red. Any medicine? An important medicine is Aurum met. Aurum met. Aurum met use Aurum met. Aurum met is an important medicine for redness of eyes. Then another medicine is argentum nitricum, strangulation of blood vessels in the eye. Blood vessels may be strangulated inside the eye. That is argentum nitricum. Ormet, please write it down. That is an important medicine. For redness of eyes without any reason, we can use. There may be the reasons may be there, but normally we cannot see that conditions. So eye cortisol, stress, inflammation. Chronic stress elevates cortisol, which disrupt tear composition. There may be normal quality of tear, and in abnormal conditions, the quality of the tear will not be right. We know that while what Ken says that due to urinary calculate, what we will do? We have to make the urine proper. Then the proper urine will dissolve the stone formation, and it will dissolve the stone of the kidney stones or urethral stones. So what to do? We have to make normal production of urine. If the production of urine is not proper, that time there will be chances of production of urinary calculi and urinary stones, kidney stones, bladder stones, urethral stones, and everything. So the production of quality tear is also one of the reasons. Otherwise, there may be irritation. Increases inflammatory cytokines. This lead to eye pain, floaters, some irritable feeling, visual snow sensations, worsening dry eye. So cortisol. Cortisol, what are the medicines we can use for to maintain the cortisol production? Nexomica. And anacardia. Nexomica, anacardia. Then delsimir. Or to reduce ignatia. Ignatia may be with mental conditions. We can use for mental conditions with cortisol production. We can use ignatia. Maddening headache with eye strain and maddening headache, and due to stress. We know that nowadays students having much stress from their LKG. They have to study a lot. They are pushing them to study everything within in their early ages. That may produce these conditions. Then old age complaints may, because of this stress, the children having pain, headache, everything due to more stress causing by the parents and the teachers. Disrupts tear production and composition, reduces blood flow to the retina, increases inflammatory cytokines, this leads to eye pain, floaters, visual snow sensations, and worsening in dry eye. Eyeballs and brain. Then coming to insulin resistance, blurry vision, blood sugar instability, alters, lens hydration, retinal circulation, nerve signaling. Symptoms include temporary blurred vision, eye fatigue, pressure sensations, often misdiagnosed as screen strain. Insulin resistance, we know that insulin production due to insulin resistance and the low production of insulin, there is more chances of blood sugar in the bloodstream. It normally affects the eye. If we drink water more, within no time, the complaints of the eye, that blurred vision will reduce. So the water maintenance balance should be always maintained. That is what is happening in diabetes mellitus. Whenever we are taking some food, immediately it will digest. Why? More production. We know that the insulin, only the insulin, except insulin, all other hormones in our body will produce sugar. More sugar. They are all diabetogenic hormones like thyroid productions, glucocorticoids, and everything, the adrenal glands, other glands. Most of the glands are producing sugar in the body. There is three chances. I have seen that three chances. One is insulin resistance. We know that the reason, the adiposity, and production of insulin may be in insulin resistance. There may be production of insulin may be normal, but the insulin is not working properly. Then the diabetogenic hormones are producing food in the, we know that canine hunger. Some medicines are, within no time they will feel that hungry feeling, always hungry feeling, because whenever they are taking in diabetes, they are taking food, immediately they go to the bloodstream. It will not sustain there. So, I heard that taking with food some ghee will reduce the speedy digestion. It will reduce and make it slow. Taking with food, we have to take some ghee with the food. Then it will not digest immediately. So the bloodstream can be somewhat, we can maintain. Then retinal circulation. These are all nerve signaling. You know everything. Temporary blurred vision. Temporary blurred vision. It may lead to glaucoma, and we have seen that in the dimness of vision and everything. Whenever they are developed, we have to keep in mind that these conditions are going on. So we have to read. Another, this medicine, I want to talk about you. Saccharum officinale, produced from canine sugar. I never use this medicine. So I want to use it, but anybody having experience, please share with me, share with us. Saccharum officinalis. According to the great Dr. Herring, a large proportion of chronic diseases of women and children are developed by using too much sugar. Sugar is an antiseptic. We always think that sugar is a septic medicine, septicon. Sugar is an antiseptic, combats infection and putrefaction, has a solvent action on fibrin and stimulates secretion. Please watch. Meditate it. You have to read the boring. You must read it and think it, and you should practice it. and give us this that has a solvent action on fibrin, stimulates secretion by the intense osmotic changes induce, thus rinsing out the wound with serum from within outwards, favoring healing. Leg ulcers. I don't know, I never used it, but anybody having experience, please share with us. Sugar must be considered a sustainer and developer of the musculature of the heart and hence useful in failure of compensation and a variety of cardiovascular troubles. Heart trouble. You know that what is happening in myocardial infarction and everything? There is fibrinogen and fibrosis. It helps it dissolves the fibrins, acts as a nutrient and tonic in wasting disorders, anemia, neurasthenia, and increasing weight and power. Now, opacity of cornea, dim sight, acidity and anal itching, cold expectoration, myocardial degeneration. Sakara of it. Fat bloated, large limbed children. Dose 30th potency and higher, locally in gangrene, 1 ounce of lump sugar, morning and evening, valuable adjunct in the treatment of obstinate cases of heart failure due to deficient heart muscles without valvular lesion. Without valvular lesion. Epilepsy, blood with reduced sugar content irritates the nervous system, is tending to conversion. We have to learn it. We have to study it. We have to make more studies in sugar. This medicine is from sugar, cane sugar. Sugar is an oxytocin, has its most suitable application towards the end of labor when there is no mechanical obstruction and delay uterine inertia. That all of that is another medicine we can use in the uterine inertia during the labor time. So here also they say there's sugar as an anti-toxic, oxytocin. Oxytocin, it produces oxytocin more, and its most suitable application towards the end of labor when there is no mechanical obstruction and delay is due to uterine inertia. 25 grams of dissolved in water several times every half hour. So, anybody having experience? Somebody may have to learn it more, then they should study and they should come forward to give some classes. I think that it is an important thing to study us for a research work. Then menopause vision changes, common menopause-related eye disorder, dry eyes, light sensitivity, eye pressure, blurry vision, cause decline of estrogen plus androgen imbalance. Here, Philip breakdown. How to restore eye health? Naturally, hormone supporting 4 strategies, omega-3, proper hydration, stress regulation, sleep optimization, anti-inflammatory diet, blue light management. How to restore eye health? Naturally, 4 strategies are omega-3. We know that rich in fish and seafood. Proper hydration, it is necessary. Stress regulation, we already gone through we know that the circadian rhythm. We have to maintain the circadian rhythm. We have taken the classes in previously, the circadian rhythm, the normal timetable of our body. Due to the times of production of different hormones in our day life throughout the 24 hours, whenever we are living, that time some hormones are producing in our body, and some hormones will be, whenever the production will lessen and the sleep comes, and serotonin, melatonin, these are the hormones which may affect, and the cortisol for pupil reflexes. The pupils of your eyes automatically adjust to let more or less light in. That reflex need to be fast, which is why it involves nerve fibers that branch off before they get into your visual cortex. These are normally, without knowing us, there are so many processes are taking place in the eye and everywhere, in each and every cell in our body. The pupils of our eyes automatically adjust to let more or less light in. Automatically it will adjust. If there is more light, then our eye will shrink. If we cannot, eye will broaden. That reflex need to be fast. Sometimes it will be lessened. The speed of the movement will be lessened. So small opening, rigidness may happen. In there, we can use the medicine for paralysis of eye muscles, costical, conium mass, which is why it involves nerve fibers that branch off before they get into your eye cortex. We know that whenever our eye ages will go and go more and more age, that time all will come. The rigidness of our life. Accommodation reflex. This reflex involves muscles in the ciliary body of each eye. These muscles adjust the shape of each eye's lens. We know that the eye lens, with pressure, it may adjust to focus the thing. That is how your eyes automatically focus on whatever you are looking at. This reflex is one of the main, whenever we, in death confirmation, we have to light test. We know that light test, that time the reflex of the eyes will not be there. That is one of the main tests we are using to find out the person is dead or alive. Somebody may call you for to do some, somebody is died and they're dead, so you come and check. So we have to check it proper, rightly, otherwise, if he is alive. I have an experience a few years back. One person called me that my father is dead, so please come and just check it. I've gone there and I taken a torchlight and I checked his eye. That time I saw that there is a small movement in his eye. So I told them that he is not dead. He lived after 1 month, he lived after that. So if I said that he is dead, what will be the situation? So that is one of the main things. So we had to check it properly. Circadian rhythm. This is like your body's internal clock. It manages your natural sleep-wake cycle and contributes to several processes like blood pressure, body temperature, and body blood sugar. The optic nerve fibers that branch off for this tell your brain about the light they detect. Most people's brain use that to help anchor the circadian rhythm due to daytime and nighttime. I told you that we are very elaborately we had taken the class circadian rhythm a few months back. You can watch it in the YouTube. Coloboma of optic nerve, glaucoma, idiopathic intracranial hypertension, neuromyelitis optica, optic nerve atrophy, optic nerve drusen, optic nerve pit, optic neuritis, septo-optic dysplasia. These are all taken last time. Toxic amblyopia. Almost most of the things I had taken last class. There are many different types of optic nerve disorders, including glaucoma. It's a group of diseases that are leading cause to blindness. Glaucoma usually happens when the fluid pressure inside the eye slowly rises and damages the optic nerve. Optic neuritis these are all taken. Multiple sclerosis. Multiple sclerosis, sometimes the cause is unknown. Optic nerve atrophy is damage to the optic nerve, causes include poor blood flow to the eye, disease, trauma, or exposure to toxic substance. Optic nerve head drusen are pockets of protein and calcium salts that build up in the a small amount of calcium or salt or foreign particles inside the eyes may produce loss of eyes, blindness. So now the time is, I think that the time is coming. So these are another multiple sclerosis, which is first breakdown. And typical nerve, damaged myelin. This is the covering of the nerve coverings. How beautifully. So the eye, whenever there is demyelination after seeing this, we know that the COVID vaccine demyelination, and one person told me that a few 1 week back that he had lost his eyes partially. Happened. These are due to damage of the myelin sheath of the eyes after taking the COVID vaccine. Now, let us okay.
Yes, if you have some more,
Pardon?
we can wind up the session.
Yeah, you can find that.
Yes, Doctor.
Because
Dr. Shweta, you can speak something, or those who want to speak. Let me check what happened to Dr. Shweta. 1 minute. Yes,
Yes,
Doctor.
doctor, I am here.
Yes.
Thank you, doctor, for your wonderful session. Doctors, if
Thank
you're
you.
having anything to share, you can turn on your mic and you can share.
What to share? Because the time is over, isn't it? Now the time is
Yeah,
only
otherwise
6
we
minutes.
can wind up because the time is limited.
Okay. Anybody want to talk? Please call them. Anybody wants to ask questions?
Yes, if anyone want to participate in discussion. Dr. Bob? Yes, Dr. Bob is here. Our Dr. Gilbert has made a wonderful session this evening, even though he was not supposed to be the guest of the day, but he was forced to do the session and he done it its time. Yes, Dr. Bob, if you want to speak, you can unmute yourself. Yes, Dr. Bob.
Actually, hello.
Hello,
Can you hear me?
sir. Hello,
Actually,
sir.
I'm going to bed, Dr. Hubert, but I forced myself to listen to you. I'm lying down on the bed. It's already midnight in Malaysia. It's a big day, but You share a very, very good topic about neurological, and you cover many, many important things, and also the anatomy and physiology, and also the relevant indication of a remedy, and that is very, very good. It's very detailed. And I'm behalf of our friends in Malaysia and IPH, I would say thank you and congratulations to you for presenting such a good webinar. And we hope that you will share more cases in this neurological thing, especially about the eye. So I would like to hear from you again very soon. Thank you very much, Dr. Hubert. Can you focus on this, multisclerosis, glaucoma, and cataract, and all this? I hope that we can have another session with you again. And thank you very much.
Thank you.
Yes. Yes, Dr. Hubert will come back with some more sessions on neurology itself. Hope. Yes, Dr. Shweta, you can wind up the session and can hand over to Dr. Anjita.
Yes, doctor. Okay. Once again, thank you, Dr. Hubert. Even though it is a sudden plan, you delivered a very good, wonderful session. Thank you, doctor. Let's wind up the session, and I'm handing over the session to Dr. Anjita. Thank you all.